everyone, I'm Dr. Tan Iping, consultant obstetrician and gynecologist. Okay, so today we're going to talk about a topic that affects a very big proportion of women out there. Okay, the main, what we're going to talk about today is called PCOS. Some people call it PCOS, some people call it PCOS, and it stands for Polycystic Ovarian Syndrome. Okay, Polycystic Ovarian Syndrome. So just based on the name Polycystic Ovarian Syndrome, we already know that in this condition, the ovary have multiple cysts in the ovary. So sometimes some women, when they come and see me, they will say, "Doctor, somebody told me my ovary got cysts and I want to check and see if my ovary has cysts." But actually what they meant is not really ovary got cysts. This name, although it's called polycystic, but actually the ovary got no cysts at all. What happens is that it looks like you have multiple cysts. It looks like you have multiple cysts, you have many cysts, but in actual fact, it is not a cyst. What is it actually? What is polycystic ovarian syndrome? It's actually a condition where when we look at the ultrasound of the ovary, we see tiny little cysts, tiny little round things that look like a cyst, but it's not a cyst. It's actually the ovum, which is the eggs that are supposed to come out. Because women with polycystic ovarian syndrome, they have problem with ovulation. So they have so many eggs in their ovary but doesn't release out, so it accumulates many inside the ovary, so it looks like many cysts. In fact, we always say it is a necklace of pearls. So pearl necklace, where you have little pearls all around your neck. So all around the ovary they have little round black color thing. And it looks like cyst, but it's actually not a cyst. So not to worry, number one, because a lot of people think cyst is a growth, cyst can be cancer. So they're very worried when doctors say they are polycystic. They're so worried. But actually, it is not. It is just your little eggs that never come out for many years. So that is why you see as polycystic. So what is this polycystic? Polycystic is very common. 20 to 30% of Malaysians have polycystic ovarian syndrome. 20 to 30%, no, a lot, And I think it's actually more than that nowadays with the change of lifestyle. This 20-30% we quote for 50 years back also we say it's 20-30%. But I believe nowadays there's more and more polycystic ovarian syndrome. Why? Because of lifestyle. Why lifestyle? Okay, first you need to know it is called polycystic ovarian syndrome. So it's also not a disease now. It's not really a disease. You're not like having hypertension, diabetes, or heart problem, or stroke, or what. No. Polycystic ovarian syndrome is not a disease. Okay, it's just a syndrome. We notice a group of women, and this group of women actually got many names we name after this group of women. It's more or less the same depending on who you see. You see a gynae, we say you got polycystic ovarian syndrome. You see a physician, what do you call that? Somebody who takes care of diabetes, somebody takes care of heart disease. They will have a different name, but it is still the same group of women. It's still the same group of women. So this group of women, we know, number one, it is a syndrome. Number one, we know their menses is always irregular. So the first criteria for polycystic ovarian syndrome, first is their period is irregular. Okay, period is irregular, number one, and they tend to be overweight or underweight, and they also tend to have higher chance of diabetes, high cholesterol, heart disease, stroke. All these things is together when it comes to polycystic ovarian syndrome. So, but as far as gynae is concerned, let's put aside our diabetes, high cholesterol, stroke and heart disease. Let's talk about gynae alone. So as far as gynae, we talk about irregular menses. First thing is irregular menses. So you need to know in PCOS, number one, they have irregular menses. So what is next? So when you have irregular menses, number two, it's also a bit difficult to get pregnant. A bit difficult to get pregnant. So because they, as I said earlier, they do not ovulate. So first, they have irregular menses, they tend to be overweight or underweight, they have difficulty in getting pregnant, and last of all, they also have a higher chance of uterus cancer. So PCOS and uterus cancer is linked. And today I am going to talk about fertility. I'm going to talk about fertility because I see a lot of PCOS. I see a lot because it's 20-30% of the women that I see every day. So I see a lot of PCOS, and time again, I see these women wasting years after years after years of their precious youth because they're supposed to get pregnant, but they wasted so many years because they didn't do the right thing, and as a result, they find it very difficult to get pregnant eventually. Because by the time they realize they need to do something, it may be a bit too late already. So that is why I want to talk about this topic today. Number one, you need to understand that PCOS, they have problem with ovulation, so very difficult to ovulate. Can say more than 90% of PCOS do not ovulate every month. They either ovulate on and off, maybe 1 year, 2 times, 3 times, or they ovulate no ovulation at all, the whole year. Can be 1 year no ovulation, can be 3 years no ovulation. Depends on how extreme the case is, because it's very much linked to diabetes. So because it's linked to diabetes, it's also linked to your age. It is also linked to your weight. So if actually you want to know more on PCOS, I have one more video I had earlier on PCOS that I talk more on the weight and the diabetes. If you want to know more on that, you can go to my YouTube channel, Dr. Tan City Clinic. You go to my YouTube channel, Dr. Tan City Clinic, you will see my profile photo, and you look for PCOS video there, and then you will be able to, I will explain a lot more on the weight gain and the diabetes. But as far as today, we're going to talk more on fertility. So you see, there are a lot of women with PCOS that have difficulty to get pregnant, and they waste so many years of their life. I always say PCOS is a solvable problem. Solvable problem, solve it. Don't sit down and wait for the baby to come. Okay? So you may not be ovulating at all, or you may be ovulating on and off. So if let's say you happen to be the one that's not ovulating at all, if you wait 1 year, 2 years, 3 years, you think what is going to happen? So I recently met one lady, married for 6 years. 6 years. And in these 6 years, she has done IUI twice. And this twice IUI she didn't get pregnant. Can you imagine if you never ovulate as a PCOS for 6 years and you only go for IUI twice? That means in these 6 years, you only ovulate twice. Do you think you have chance to get pregnant? What is your chance of getting pregnant? It's very, very low. So because other people who are ovulating every month, in 6 years, how many times would they ovulate? 70 over times already. People ovulate 70 over times, and you only ovulate 2 times. So all 6 years, you ask me, wasted. Why these things happen? Sometimes it's because they are not aware that they need to start on treatment. Sometimes it's because they started on some treatment, but they didn't get pregnant, and then they stopped going to see doctor. And probably also the doctor never give that appointment. Or maybe the doctor tell them, if still not pregnant, you come back, but they didn't go. Or they go and see one doctor, they go and start treatment, and then not pregnant, and then they stop going to see that doctor, and then after some time, they're not pregnant, they go and see another doctor, they have to start all over again, and then still not pregnant, then they wait another 1-2 years, and then if they're not pregnant, they see another doctor, they start all over again. So that's why I always tell these women that, as I always say in my last video, fertility, time flies, you know. 1 month, suddenly it's 1 year, suddenly it's 2 years, suddenly it's 5 years, and suddenly it's 10 years already, without knowing it. Like recently, you see MCO, so fast time flies. MCO never see doctor, wait until now and see doctor. See, so many months pass already. So age is something that is also catching up. And then now that 6 years has passed and she's no longer that young, it is even more difficult to treat her. Why more difficult? Number one, PCOS, the older you are, the more difficult to ovulate. If you are 17, 21, most likely you still ovulate on and off. Then if you see doctor, I give you medicine, you definitely ovulate. If you are 31, maybe you are not ovulating anymore on your own. Then if you see doctor, also maybe cannot ovulate. So you see, the older you go, the more difficult to ovulate as a PCOS. Even you come and see doctor, the older you are, the more difficult the medicine will work. I have this lady also, I remember, she has PCOS many years ago. She saw me. Then I give her simple Clomid, I give her. And then she ovulate. She ovulate with Clomid. Then she got pregnant. Happy already, pregnant. And then give birth already. But after give birth, she didn't do anything. She kept on waiting. And waiting, and waiting, and waiting. And then many years passed already, 3-4 years not pregnant. She come back to me. So you see, 3 years not pregnant, 1 year pregnant, 1 year trying to get pregnant. I mean, it's like 4-5 years difference already, the time she see me today and the last time she saw me. So she thought very easy, come back and see Dr. Tan, get Clomid. And this time she take Clomid, it didn't work. She never ovulate anymore with Clomid. See? So I say, the older you are, the more difficult for the medicine to work even. So it's always better to come and see us earlier. So in PCOS, the older you are, the more difficult to ovulate. Whether on your own or whether with treatment, it's more and more difficult to ovulate the older you are. Number 2 with PCOS is the fatter you are or the thinner you are, the more difficult to ovulate. So some people, when you grow older and older and older, you just keep putting on weight, keep putting on weight, because it's natural, you see. It's natural for everyone to put on weight as they grow older. So the older they grow, the more difficult, and the higher their weight, the more difficult they ovulate. Those PCOS that are underweight, the thinner they are, the more difficult they ovulate. I had this one lady, I still remember. She's so thin. She's so thin. Thin until the period always never come. Then when she got married, she wanted to get pregnant. So what did she do? She came to see me, I gave her Clomid, and then she got ovulation, and she got pregnant. And then pregnant, she put on, you know how much? 25 kg. Oh my God, 25 kg. But what made her after that? After she gave birth, she's no longer thin. She's no longer thin. She put on 25 kg. I know she's overweight, but she's very underweight. So if you look at her weight, she's not overweight yet. So I gave her, after she gave birth, her period become regular. No, every month come. See, the weight solves the problem. For those who are overweight, if you can lose the weight, it's easier said than done. But I have seen women who can lose like 10 to 15 kg in 1 year. And these women, after they lose their 10 to 15 kg, their period come every month regularly. But for women who are thinking about fertility, I don't want you to waste too much time losing your weight or putting on weight, because it's not easy. It's not easy. And then I know many of you have been trying and trying. Doctors say, go back, lose weight, then you get pregnant. Then you go back, you try and lose weight, and lose and lose. You lose 2-3 kg, you put on 2-3 kg. You lose 2-3 kg, you put on 2-3 kg. You couldn't lose the weight, and then very fast. I told you, fertility, time flies. Suddenly, it's 1 year already. Suddenly, it's 2 years already. Doctors say, lose weight, you get pregnant. Suddenly, 3 years, 4 years, 5 years, the weight still never come down. How? So, I normally feel that for PCOS, I mean, weight is important, but we shouldn't wait for the weight to go down. We cannot wait for the weight to go down. We need to treat you first. We need to treat you, we need to get you pregnant. Your weight can come down slowly, but we still need to get you pregnant. Okay? We ask you to lose weight, but we still need to get you pregnant. We cannot wait for your weight. We cannot wait for your weight because it's easier said than done. Okay? So, these are the things that can happen. So, let me describe a bit about my life. My life, I have PCOS. I have Polycystic Ovarian Syndrome. As a teenager, my period was never regular. And you know what? I actually grew up in a Chinese Singsei family, you know. So my grandfather is a Chinese Singsei. So from young, my period is never regular. So my mother will go and boil all kinds of herbs for me to eat. Trust me, nothing works. And eventually, I know why nothing works. Because in the past, we didn't know that polycystic is due to diabetes. Actually, it's all due to diabetes. So probably whatever herbs my mother gave me to regulate my menses, it didn't work at all. Okay, never mind, didn't work, never mind. I'm already so used to my period abnormal, and I'm so happy actually at that time. Don't want every month come, so troublesome. Better 6 months, 1 year come once. Okay, so I lived with that for many years. Until I was in medical school, and then I realized, oh my God, polycystic ovarian don't get pregnant, can cause uterus cancer. I cannot like that go on 1 year, 2 years, no period. So those days my polycystic is very bad one. I can have 1 year also no period one. So I went and see my professor, and then my professor asked me to go on oral contraceptive pill. Imagine I'm not married, ask me to go on oral contraceptive pill. If I were to ask your daughter to go on oral contraceptive pill, all of you will say no, right? But do you know that that is the only way to protect your uterus if you are having polycystic ovarian syndrome? But for fertility, cannot lah, fertility cannot. I also see women polycystic go and see doctor, get oral contraceptive pill, and he take for 3 months, 6 months to regulate the period, and then hoping to get pregnant after that 6 months. It doesn't work one. Okay, oral contraceptive pill only make your period regular when you take it. When you stop it, your period again not regular, again you're not ovulating. Don't waste your time on oral contraceptive pill. So then what happens after you finish? So what happened to me? So okay, I took oral contraceptive pill, but the moment I got married, after a couple of months, when I started working, I don't want to get pregnant so fast. I just wait for a few months, because houseman cannot get pregnant, give birth. Give birth after my housemanship, I have to prolong. Houseman is a torture. I don't want to prolong my housemanship. I want to fast finish my housemanship. So I waited for a couple of months. I count nicely, so by when, if I get pregnant, sure, I give birth after housemanship one. So then I went and see my gynae. Straight away, the moment I want to get pregnant, straight away I go and see the gynae. I tell the gynae, I got polycystic ovarian syndrome, I don't ovulate one, I want to start treatment now. See, the right thing for polycystic ovarian syndrome women to do is, the moment you are married and you want to get pregnant, you should straight away go to the gynae and say, doctor, I got polycystic ovarian syndrome, I want to get pregnant now. I'm not ovulating, why I wait? I wait is a waste of time. Can you imagine if I sit down and wait for 1 year and see whether I'm pregnant or not? I would have nicely wasted 1 year. And I say fertility, time flies. 1 year, older by 1 year, more difficult to ovulate by 1 year, grow fatter by 1 year, grow older by 1 year, egg reserve reduced by 1 year. What's the point? Don't wait. Married, straight away, go and see gynae, say, doctor, I got polycystic, I want to take medicine to get pregnant. Then we start you on medicine, no? Okay. That's why I always say that polycystic ovarian syndrome is a solvable problem. There are many more medications out there. We have Clomid, we have Femera, we have Glucophage, we have injectables, we have ovarian drilling, we have... Yeah, probably that's all. But there are many. So normally what happens is that we always start with one. Then we see whether you ovulate or not. If you don't ovulate, then we go to the second one. Then we see whether you ovulate or not. If you don't ovulate, then we go to the third one. Then we see whether you ovulate or not. So don't keep changing doctor and keep changing doctor and keep changing doctor. You know when you keep changing doctor, you go and see a new doctor, again start from the first one. Again start from Clomid. You see, so you waste your time again. Don't. Stick to one doctor and see whether Clomid work. Clomid not work, try the next thing. Next thing not work, try the next thing. Next thing not work, try the next thing. But the thing is, you must be willing to try lah. I think I got one interesting couple today ask me, what do you think is our chances to get pregnant? I say your chances is very high if you walk the path. Now what I mean is if you walk the path. So first I ask you, give you this medicine. You take lah. Don't think left, think right, Google left, Google right. Then don't want to do. Then don't want to do. What to do? Then not ovulating, no need to get pregnant. And wait, continue waiting and waiting and waiting. Everything in this world also got pros and cons one lah. But you want to get pregnant ma. You want to get pregnant, you don't have a choice if you're polycystic. Because polycystic most of the time not ovulating unless you are that less than 10% polycystic that ovulate on their own, then ask the doctor to prove to you that you're ovulating. If you're proven ovulating on your own, you don't need treatment. But if you're not ovulating, then you wait for what? You wait for ovulation, it doesn't come. So what happened with me is, first I tried Clomid. Okay, those days was like 20 years back. 20 years back, not many medication available. So first I start with Clomid. More than 20 years already. I start with Clomid. And then when I start Clomid, then it doesn't work on me. So my doctor, my gynae label me Clomid resistant PCOS. Now I'm Clomid resistant. Clomid don't work on me. How? Then I went to try on injection. My doctor asked me injection. Those days they don't know about diabetes, they don't take glucophage, they don't take a lot of medication, not available yet at that time. So Clomid don't work, then go for injection. So I try injection. Those days injection also very limited, not many types only. I inject, also no ovulation. Then what happened? Then I went and do ovarian drilling. So I did ovarian drilling. Then after I do ovarian drilling, then I got pregnant. Sorry, I didn't get pregnant. After I do ovarian drilling, then they found out I got endometriosis. They saw my endometriosis, they put me on Lucrin. Then after that, I went back on Clomid. And then I got pregnant. I only took 3 rounds of Clomid the next time. So you see, earlier I take Clomid, it didn't work on me, no ovulation. But after the ovarian drilling, when I take Clomid, I was ovulating already. And then honestly, after that, I already ovulate on my own. Because my second pregnancy, I just got pregnant out of nowhere. I'm pregnant already. So, because what happened with ovarian drilling is, sometimes you can even ovulate on your own. But not everybody will ovulate on your own with ovarian drilling, because depends on how much the doctor drill. When we do drilling, we have to be too much also no good, too little also no good. I don't drill enough, it may not even work. If I drill a bit more, it will work, but you still need Clomid. I drill a bit more, then it will work on its own, you don't even need Clomid. That's why every patient of ours, the response is different. A small percentage we drill, still never ovulate, that one drill not enough. If I drill a bit more, then some of them, they ovulate, but they need Clomid to ovulate the next time. But some women, after drilling, you don't need to give Clomid, nothing, they're already ovulating on their own. So you drill a bit more, then it's the perfect one. And then if you drill a bit more, then we also worry about ovarian reserve. So that is why today I got one lady, she already tried 4-5 years already, PCOS. And then I tried her on Clomid, didn't work. I tried on Femira, didn't work. She has done glucophage, never worked. What else next? Other than injection? If not, then it's ovarian drilling. Then she said, I heard ovarian drilling got this bad thing. It can have bad effects on our ovary. I say true. It depends on how much we drill. But if not, then you see all medicine doesn't work. You don't ovulate, everything don't ovulate. And then not only that, she already has pre-cancer treated. Because ovarian PCOS is linked to uterus cancer. So if you have pre-cancer, you can't be sitting down here doing nothing. You do nothing. First, you're not ovulating. Next, you're not getting pregnant. And your cancer can come. So what choice do you have? So that's why I say sometimes cannot think so much for PCOS. If you think so much, this thing, everything also got side effect. But then if you everything also don't do, then how are you going to get pregnant? How are you going to get pregnant if you everything also don't do? So that's why I always say women, actually all women, it doesn't matter whether you're PCOS or non-PCOS, every woman in this world definitely can get pregnant one. If you are willing to walk the path. Very often they all don't want to walk the path. It's always the couple don't want to walk the path. We ask you to do this, think, don't want. Take second opinion, third opinion, fourth opinion, fifth opinion, everything don't want, don't know what to do. And then never pregnant, no? Because we know how to solve your problem. But then you not willing to take the path to solve your problem. We know how to get you pregnant one. I always tell women today, money may be the biggest problem. But if you have money, everything is solvable. Okay, maybe to some people, religion can be a problem. Because some religion have certain practices they are not allowed to do. But if religion is not a problem, money is not a problem, there's no reason why you're not pregnant. You're not pregnant because you're not willing to walk the path, or you probably dilly-dally here and there, or never actually solve the problem. So let's say you see a doctor, the doctor give you one treatment. As I mentioned in my last week video, if you get one treatment, not pregnant after 6 months, go back and see the doctor. Ask for more treatment. What's next? What's next? Because doctor never give you appointment. Doctor say we try this, not pregnant, come back. Then how long you want to wait? 2 years, 3 years? Don't wait 2 years, 3 years. As I say, time flies, and you're getting older and older every day, not younger. Your ovarian reserve getting less. Women gets menopause over a certain number of years. Men also go to andropause certain number of years. And PCOS never wait. Why? Because you can get uterus cancer. I have so many, I've seen so many, either pre-cancer or cancer. Trying to get pregnant, never get pregnant, 1 year, 2 year, 3 year, 4 year, then after cancer already, no need to get pregnant. How? So don't. You know your period is irregular. If you know your period is irregular, first thing you need to do is just marry, straight away go and see doctor, say, doctor, I have PCOS, I want to get pregnant, start treatment. No need to wait. Wait for what? PCOS, don't ovulate. Wait for what? Right? Number 2, doctor start medicine, not work, 6 months, ask for some more. 6 months, ask for some more. Ask for some more. Don't sit there and wait. Because you have polycystic, you cannot wait. You cannot wait because when you grow older, medicine is more and more difficult to work already. You cannot wait because you can get uterus cancer anytime if you don't get pregnant. You cannot wait because your age is catching up, your ovarian reserve will come down. So you cannot wait because the older you are, even if you are willing to do IVF may not work because you're too old. So you cannot wait. You have no option. You just have to go and keep asking for treatment until you're pregnant. And let's say if you try this, not pregnant, ask for some more, not pregnant, ask for some more, whatever your doctor give you. Don't think so much. Don't Google so much. I very scared patient Google here, Google there. Okay? Because everything got pros and cons, but you want to get pregnant ma. So something I always tell a lot of couples who are trying to get pregnant, they ask, this thing got risk or not? That thing got risk or not? I tell them, getting pregnant is the most risky thing. Because in my hands, women who give birth, get pregnant, give birth, can die. And I do see them dying. People who want to get pregnant, just want to go for fertility treatment, got risk, but I never see anyone die one. So, what is more risky? Pregnant. Pregnant so risky also you're willing to do. Why? Because got baby ma. Baby is the reward. Then, fertility, how risky? Also same what? Why? Because get baby ma. Baby is your reward. So the reward is worth the risk. So don't need to worry so much. What's the risk? What's the side effect? Well, you want baby, right? You have to do it. If you're not willing to walk the path, how are we going to help you? That's why I say, must be willing. Take injections, what's the side effect? Take medication, what's the side effect? This is some of my mothers, they understand that. Maybe they take clomid also, they got side effect, but they still take. Why they still take? Because they want baby ma. Have to face it lor. They say, doctor, it's okay. The side effect, I can take it. I want to get baby. Take it lor. Because clomid, sometimes they get giddiness, headache. Metformin, you feel like want to vomit. But you want baby ma. All these side effects don't die one. So, if you want baby, then you need to do it lor. You need to take it. Okay, so that is my advice for you. So today, I'm basically talking about PCOS only. Anything you want to ask about PCOS, please put in the comment section. And also, I do advise all of you to sign up for my coming fertility seminar. In what way will this fertility seminar teach you? Number 1, it gives you more knowledge. You need to understand that you can be having PCOS, but you can be having so many other problems not making you pregnant other than PCOS. Like for me, when I knew I got PCOS, I went and do my drilling. But during the drilling, I found out I got endometriosis also. So I also need to know what to do with my endometriosis, right? So if you have PCOS also, I very, very much advise you to go to join my fertility seminar to gain more knowledge. And in my seminar, I also have a lot of cases that are successfully pregnant that I share with all of you. So do join my fertility seminar this coming month, and then at the link below, just sign up, okay? So yes, just click onto the link and register. What other questions you have, please post it up. I'm waiting for questions. And just remember the main thing I told you already. Polycystic, number one, first, if you have irregular menses, please ask doctor whether you're polycystic. Once you know you're polycystic, the moment you want to get pregnant, start treatment. No need to waste your time. No need to wait 1 year, 2 years, 3 years. No need. Married, start treatment. Start treatment when you're young. If it doesn't work, give it 6 months. Doesn't work, go back to your doctor, ask for some more. Not work, go back to your doctor, ask for some more. Not work, go back to your doctor, ask for some more. Okay? So please go and keep doing as fast as you can, because polycystic cannot wait. Cannot wait because as you grow older, everything that works on you young may not work on you when you're older. Number two, we worry that your uterus cancer may come, because polycystic got high risk of cancer, and if cancer comes, then no more chance of getting pregnant. We also worry that the older you are, your ovarian reserve come down, then it's more difficult to get pregnant. And we also worry that you grow old until the moment you want to do IVF or whatever, it doesn't work anymore because you're too old. So don't wait too long, don't delay treatment, don't wait anymore, okay? Okay, so but you want to know other things about polycystic, do go to my YouTube channel, which is Dr. Tan City Clinic. If you can, subscribe to my YouTube channel and look for the video on PCOS. I explain a lot more about PCOS in the other video, okay? So let's see what the questions you have now. Okay, Suyun asked what is ovarian drilling. Ovarian drilling is a surgical procedure. It's a surgical procedure which is a laparoscopic. Usually we poke 2 or 3 holes on your tummy and then we go and drill the ovary. So that's all. We need to drill the ovary. The more we drill, as I earlier mentioned, one of the things that cause ovarian PCOS when you are we do ovarian drilling only in PCOS that are resistant to all treatment. That means all treatment doesn't work. You try this medication, doesn't work, that medication doesn't work, that medication doesn't work. So if all medication doesn't work, then only we think about surgery. So surgery is ovarian drilling. Ovarian drilling is a surgery that we poke a few holes into your tummy, inside go into your ovary, and then put a few, drill a few holes in your ovary. The number of holes we have to drill very depends on how bad your PCOS is, okay? How bad your PCOS is, then we will drill. So that is ovarian drilling. That is one of the ways of getting pregnant. I always feel that ovarian drilling has one advantage over medical treatment, only one advantage, because ovarian drilling is long term. Let's say if I give you medication today and then you conceive or you ovulate, but then after you give birth again, same story, you still cannot get pregnant, you still not ovulating, then you have to take medicine again and again and again. Or maybe you take medicine today, you ovulate, but you never get pregnant, and next month you need to take medicine again and medicine again and medicine again. But ovarian drilling, usually the effect is long term. Let's say, like for example, for me, I did my ovarian drilling 20 over years ago. Until today, I'm still ovulating. So before that, I never ovulate never ovulate. Now I'm ovulating every month. So you see, so ovarian drilling, the effect is long term. Now I'm ovulating every month, but I'm not interested in getting pregnant anymore. And after my first pregnancy, also I got pregnant on my own the second time. So you can see, I can ovulate on my own already. I don't actually need to depend on medicine. So ovarian drilling has one advantage. But when you depend on medicine, you always depend on medicine. It's the same like people ask me, is it better to go and do the drilling or do IUI? I say in IUI do help in PCOS, but let's say IUI didn't help you the first time, then you have to keep doing IUI and keep doing IUI and IUI. You know, I have women who maybe first pregnancy, they got pregnant with IUI, PCOS, and then after that it's still the same. You still have PCOS anyway, the ovulation doesn't come, so after that you want to get second pregnancy, also cannot. Then you need to go for IUI again and IUI again and IUI again, and not every time your IUI will be successful, so you need to do many times of IUI to get pregnant, to have the number of children you want. Maybe you want 3 children, but end up you do 10 times IUI. But ovarian drilling is only once. But of course, ovarian drilling is a surgical procedure. It's still something that we will not do it as the first time. We never do it as the first time, okay? We usually do it as the last option. We still do it as the last option. But it's not really a bad option, because you see, it can help you forever. It may be able to solve your problem forever and ever already. And because nowadays, if your period comes every month, then you're still not worried about cancer and things like that, right? Okay, Shirley asked, my period cycle is 28 days every month. Why I can't get pregnant? Okay, Shirley, if your period is 28 days every month, then obviously you are not PCOS. Most likely you're not. And ask, is PCOS automatically treated after pregnancy? No. You see, PCOS is very much related to your weight. So let's say you're very, very thin and then you put on a lot, like the case I mentioned earlier, then the PCOS is solved after she gives birth because now her weight is normal. If let's say you're very, very overweight and then after you give birth you lost a lot of weight, yeah, maybe your PCOS can improve. But let's say typically people get pregnant, they put on, right, they don't lose weight. So if you got PCOS and then after you got pregnant and give birth, you put on so much more weight, actually your PCOS is worse after you give birth. Unless, like for example, I told you about myself, my PCOS solved already, is because I did ovarian drilling, okay? So that's why a lot of women with PCOS, after they give birth, they need medication again to get pregnant again and again and again. Suyun asks why PCOS is linked to ovarian cancer. No, it's not linked to ovarian cancer. It's linked to uterus cancer, not ovarian cancer, okay? So it's linked to uterus cancer. Why is it linked to uterus cancer? It's linked to uterus cancer because of the hormonal changes that is happening. In PCOS, you have a imbalance in your hormone. You have too much estrogen, not enough progesterone, because you're always trying to ovulate, but you never ovulate. Because in our menstrual cycle, our estrogen goes up in the early part of the cycle, and towards the end part of the cycle, only the progesterone will come out. To prevent, you need to ovulate for the progesterone to come out. You need to ovulate for the progesterone to come out. But if you're not ovulating, then your progesterone doesn't come out. Because for uterus cancer, you need progesterone to protect your uterus. So that's why for people who have pre-cancer for uterus, you put them on long-term progesterone. So if you're on long-term progesterone, then you don't need to worry about uterus cancer. So PCOS, the problem is if you don't ovulate, then your progesterone don't come out. So your body do not have progesterone in your to prevent the uterus cancer. If maintain the period regular PCOS, risk of uterus cancer still high. If you use something, that means you must first ask yourself, your regular menses is what? Is your regular menses with ovulation? If it's with ovulation, then of course you have no worries about uterus cancer. But if it's regular but there's no ovulation, then it is still the same. Your risk of cancer is still high. If you take something to regulate your menses, that means you usually take hormones. If you take hormones to regulate your menses, definitely it will be protective because your hormones will make sure your period come every month, and all hormones that you take usually will also have progesterone to protect your uterus. Okay? Doctor, Jessie asked, Doctor, why PCOS has something to do with diabetes? So just now I did mention that 20-32% of women in Malaysia will have PCOS because it's very linked to diabetes, and I feel that the number may be more than that because this 20-30% is a statistic that we used many years ago, but women today should have more diabetes, so there will be more PCOS. Why is it linked to diabetes? It's actually not linked to diabetes, it's due to diabetes. What I mean by due to diabetes, actually you need to understand this whole diabetes thing. You are born with it, you're all born with it, you're born with diabetes. But the diabetes, when you're younger, is still well controlled. So what happens in people with diabetes when they're young? You probably need to eat very sweet, then only your sugar go up. Then as you grow older, you don't eat so sweet, also the sugar go up. Then you grow older, you eat normal, no sweet things at all, then also your sugar go up. Then you grow older, you don't eat, also your sugar go up. So when you don't eat or when you're fasting, your sugar is high, that is where we say you have diabetes. But actually you have diabetes from the day you are born. It is slowly going up. How fast it go up depend on your diet, your lifestyle, your exercise and things like that. So there are actually a lot of women in the past, long ago, because their lifestyle is better, maybe they get diabetes when they're 70. So when they get diabetes, they're 70, right? So this line is a lot flatter. So even the PCOS also take later to come. That's why there are people who only get PCOS like maybe in their 30s rather than 20s because they are on the lower curve. So they get diabetes older. Let's say you're going to get diabetes when you're 40, then your curve will be, this line will be higher. So you get PCOS at a younger age because you're going to get diabetes earlier. So this thing, it depends on your line. But of course, this line is not always straight. It all depends on whether you take care of diet. So if you have PCOS and you all along as a child, you simply eat all the sweet things, but now you do already, you start controlling yourself, you can still flatten the curve, flatten this line so that you do not get diabetes so old, and that also your PCOS also doesn't worsen so badly. So actually, diabetes is PCOS, PCOS is diabetes, so it's not really PCOS linked with diabetes. Yeah, they're all the same thing, okay, they're all the same thing. It is all due to the way we name things. We didn't know that PCOS is due to diabetes until maybe 10-20 years back, maybe, or 20-30 years ago only we know. So, but this Polycystic Ovarian Syndrome, this name is already there like 50-100 years ago already. Long ago already people know about this Polycystic Ovarian Syndrome, but we didn't know it's diabetes. So, long ago we know it's diabetes. And long ago, it depends on which doctor. That's why I say, you see gynae, we say you're PCOS. You see a physician, you say you're diabetic, but they're linked lah. They're linked, okay? So they are linked. Okay, so that's all the questions I have today. So remember the things that I mentioned earlier. So if you have PCOS, number one, first of all, if your menses are irregular, you should always check and see whether you have PCOS. Once you know that you have PCOS, or any doctor already label you as PCOS, the moment you're married, don't waste time. Just straight away see doctor and say, I want to get pregnant now. Ask for medication. Doesn't work 6 months, go back to the doctor, ask for some more medication. Don't not work 6 months, go back again to doctor, ask for some more medication. Keep asking until you are pregnant. Okay? So that is the advice I have for women with PCOS. And the rest of you who want to know more about PCOS or any other things about gynecology, I have already 20 to 30 live videos out there already, and we upload them all in my YouTube channel. So go to my YouTube channel, which is Dr. Tan City Clinic. There you can find, number one, you can find a video on Polycystic Ovarian Syndrome. You can also find video on fertility. You can also find video on uterus cancer. So if you want to know how to protect yourself from uterus cancer, go and look up my video in my YouTube channel, okay? So my YouTube channel is Dr. Tan City Clinic. Go to that channel, alright? So that's all for today. Any more questions, please put in my comment section. Please put in my comment section so that I have ideas what to do next, okay? So that's all for today. See you same day, same time next week. Okay? Sunday, 9 p.m. Bye!